Hello everyone. Today's lecture is going to be on sudden and unnatural deaths. There are several learning outcomes that you have to fulfill at the end of this lecture. Firstly, you need to be able to define what a sudden and unnatural death is, and then of course identify some of the causes and mechanisms that lead to sudden deaths. Then you need to know a little bit about the legal formalities when investigating sudden and unnatural deaths, particularly in relation to Malaysia and also in the world in general, and how the forensic autopsy would assist when investigating these types of deaths. Let me first start with a few introductions and explanations. So let me first introduce myself. I am Dr. Sameera. Before I came to IMU, I was at the University of Colombo in Sri Lanka, where I worked as an academic and a forensic pathologist. So, as a specialist in forensic medicine, our role primarily is to investigate into sudden and unnatural deaths. And of course, in these cases, we conduct autopsies, we collect evidence, we provide medical legal reports, and sometimes we have to give evidence in courts of law. Now, it's important that you realize that forensic practice would differ based on the jurisdictional and legal structure of any country. So pretty much most of what I would be discussing here today in this lecture is based on the experience that I've got working in Sri Lanka and also for a shorter period in Australia. But of course, the practice or the protocols that are implemented in forensic work may differ from region to region. And if you ever do happen to work in a particular forensic setting, you have to be thorough and you have to be aware about the principles, the legal principles, and the jurisdictional structure in the country that you are working in. Forensic medicine is a somewhat interesting area to work in. It's a branch of medicine where basically medical principles and medical concepts are applied in civil and criminal legal matters, mainly for the benefit of justice, but also sometimes for public administration and civil compensation issues and so on. The investigation of deaths is a main component of forensic medicine practice. And the importance of investigating deaths is not only in terms of law enforcement in scenarios of homicides or accidents where the crime investigation takes place, but there is another area where investigation of deaths benefits the healthcare system, the public health in general, in terms of improving public health, in terms of improving the quality of management, in terms of identifying diseases or health risks. So there is a much wider benefit that comes into the community by these investigations that happen into deaths. And also we have to consider the family aspect. Now, in most situations when a family loses a loved one, there is a lot of grief and sometimes there is concern as to the reasons for a particular person's death and also whether the diseases, for example, would also affect the family members. So through these investigations, we may be able to assist the family members, especially in terms of identifying certain familial diseases and thereby referring these family members to particular specialized units for prevention and management of those diseases. So in the investigation of deaths, autopsies are an important part. The word autopsy, I think you have already learned from the previous lectures. The words autopsy, necropsy, postmortem examination pretty much mean the same thing. But it's important that you understand that there are essentially two types of autopsies that could be conducted. And we refer to them as pathological autopsies, where the death is investigated primarily for education and research purposes, or it could be a forensic autopsy where the investigation is for legal purposes or for public administration. Now, it's important that you also know the differences in the procedures between these two types of autopsies. For example, if we were to do an autopsy for educational purposes, it's important that it can only be done in natural deaths where the cause of death is known, and also the consent has to be obtained from the immediate family member or the next of kin. That is mandatory. Whereas in forensic autopsies, the deaths may be conducted in what are called reportable deaths. Now, these reportable deaths I'll discuss a little bit further down the line, and they would be either natural or unnatural deaths. However, they are essentially deaths that are reported to a higher authority for a legal investigation, and therefore the order for an autopsy comes through a legal channel. It may be a coroner, it may be a magistrate, it may be the police. So there is an authority given through a legal requirement, and therefore in forensic autopsies the consent from next of kin is not required. It's not mandatory at all. And of course, whatever information is obtained through the forensic autopsy would be considered as evidence and therefore would be presented to a court of law. Okay, now let's come to our first objective, which is defining what sudden and unnatural deaths are. Now, you may have heard several scenarios where people have died suddenly, and sometimes these deaths are mysteries. The famous martial arts expert Bruce Lee's death is one such mystery. No one still really knows how he died, although many believe it is a natural death. There are several rumors about certain unnatural possibilities as well. Sometimes people die suddenly while engaged in physical activity, while working or during sports. This is the incident depicted here is Cristiano Jr., who died during a football match in India, I believe. So, what really are these sudden deaths? Now, the WHO, the World Health Organization, put out a definition saying that any death which occurs within 24 hours of the onset of any signs or symptoms would be considered as a sudden natural death. Now, of course, this definition applies mainly to natural deaths, whereas in a forensic setting, we would also consider non-natural types of deaths, and therefore, in a forensic setting, the definition would be more towards an unexpected or unexplained death which happens in the absence of a fatal predisposing condition. So the causes of these sudden deaths primarily depend on the circumstances of death. And let's have a look at what we really mean by these circumstances. It's an important word for you to know within your forensic science and also forensic medicine knowledge. So the circumstance of death essentially means the scenario behind how the death occurred. Now, in most situations, a person would die naturally, that is due to some form of disease or simply because of old age. But of course, there are several reasons why a person would also die unnaturally, and these are essentially traumatic types of deaths. Now, trauma can be both physical trauma as well as other types of trauma, like, say, for example, drug overdose, toxins, being attacked by an animal, or being a victim of a natural disaster, like, say, a landslide or a tsunami. These are all traumatic deaths, and therefore they are considered as unnatural deaths. Now, unnatural deaths can also be of three types. For example, let's say that there is a person who has a gunshot injury to the head. Now, this person has died because of a gunshot injury to the head. But how did he get that gunshot injury? Could it be because he committed suicide, that is, he shot himself intentionally to kill himself? Or could it be that it was an accident while he was, let's say, cleaning a gun, that the gun suddenly discharged? Or was he shot by someone else with the intention of killing him, which would be a homicide? So you see, any type of unnatural death can also occur under these three circumstances, that is, suicide, accident, and homicide. So eventually, a person would die under four circumstances or four manners of death, that is, natural, accident, suicide, or homicide. And of course, accident, suicide, and homicide would be grouped as unnatural circumstances. So this is the main understanding or definition of circumstances of death, and you have to be very clear on that. Right. Let us now go to the second learning objective, which is to discuss some of the causes and mechanisms of sudden death. Now here, firstly, we shall talk about sudden deaths within natural scenarios, not the unnatural situations. Of course, when it comes to sudden natural deaths, we have to understand that cardiovascular causes are number one. They outnumber the other types that you see here, like central nervous system disorders, respiratory conditions, abdominal, that is gastrointestinal conditions, endocrine diseases. So these are all much lower in their prevalence compared to cardiovascular deaths. Similarly, you can have scenarios of sudden death which do not really identify a specific cause. We refer to them as indeterminate causes. And there are mainly two types of indeterminate causes that we encounter, especially in forensic practice. These are mainly what we refer to as sudden infant death syndrome. You may have heard of the term SIDS, which is a condition that affects primarily infants, usually less than 6 months of age. And there are several risk factors for this SIDS happening. Most of the time, these happen in children who are within low socioeconomic backgrounds, often living in overcrowded spaces, and usually there is a history of smoking, alcohol within the family, both the mother as well as the father. So the mechanism how these sudden infant deaths occur is not quite clear. And often the scenario is that the baby was put to sleep, and the later on when the caregiver or the parent went to check up on the baby was not breathing. So there is no preceding illness or any kind of unnatural event that could be explained um, as to how the death occurred. So it was just sudden, and there was no, and even after the autopsy, including the scene visit, if there is no probable reason that can be given, then we refer to that as a sudden infant death syndrome. Similarly, another category of people who have this sudden unexplained deaths are people who have epilepsy. Now, people with epilepsy can die from various reasons. For example, even while they're fitting, they may actually aspirate themselves, or they may fall into some kind of hazardous environment, like say, for example, they may fall into water and drown, or they may fall from a height. So in these situations, of course, the cause of death that would be clear. It would be either drowning, or it would be because of head injury following the fall, and so on. But in some situations, we know that the person has had epilepsy, but they are just suddenly found dead. So there is no witnessed, let's say, incident or witnessed trauma to explain the death. It's just that they are suddenly found dead, and even following the autopsy, there is no visible pathology to be identified. So these are therefore referred to as sudden unexplained death in epileptic patients. And again, there are several theories as to how this happened. Some believe it is a situation of respiratory dysfunction. There may be a cerebral dysfunction that happens, and also cardiovascular situations like arrhythmias and so on, which could happen primarily because of both the condition, that is the epileptic condition, as well as the drugs or the treatment that is given for this condition. So as I said, the main reason for sudden deaths are cardiac causes, and of course under these the number one cause would be coronary artery atherosclerosis, which is basically collection of fat within the coronary arteries. As you can see here, development of the plaque now narrows the coronary artery lumen and therefore reduces the blood flow within that artery. And of course, once the blood flow is reduced to a critical extent, that can lead to an infarction of the myocardium, of the heart muscle that is supplied by that particular artery. So this is generally referred to as a heart attack. Now, of course, apart from this atherosclerotic type of disease that affects the heart, there are several other reasons, such as, for example, structural abnormalities. And out of these structural abnormalities, possibly the hypertrophic cardiomyopathy is one of the commonest reasons why people suddenly die. It is also one of the common reasons of enlarged hearts in young people. But there are several other reasons. For example, there can be valvular defects. There can be anomalies in terms of the coronary artery distribution. So nothing to do with atherosclerosis like what is shown here, but it's just that the coronary artery distribution or the layout of the coronary arteries are abnormal. Then you have another particular a subset of cardiac conditions called the channelopathies. By channelopathies, what we mean is that you know that for proper cardiac function, there is also the electrical discharges that happen, the cardiac conduction system that is essential for proper heartbeat. Now, of course, if there are any abnormalities in the conduction system, in the way that the electrical impulses are discharged, then that can lead to sudden deaths. And these are generally referred to as arrhythmias. Several arrhythmias are also known to be familial, that is, that they are based on certain genetic mutations which run through the generations. The other types of cardiac causes, of course, are acquired, that is, they happen later on in life due to some form of either infection or trauma. We'll learn a little bit about how some types of drugs can affect the heart, especially some types of narcotic drugs, performance enhancing drugs. These can actually have a very toxic effect on the heart and cause certain pathological abnormalities which can cause sudden death. Now, in terms of respiratory causes, I would say that pulmonary thromboembolism is pretty much the commonest cause. Pulmonary thromboembolism is a scenario where there are blood clots, thrombi, occurring in the deep veins of the leg or other peripheral veins, which can get detached and they enter the circulation, the venous circulation, travel up the venous circulation into the heart, the right ventricle, and then the right ventricle pumps it out into the lungs. And here the blood clot that is now within the circulating within the blood can actually get lodged in either the main pulmonary trunk or in one of the peripheral arteries, causing an infarction of the lung. This is mostly seen in people who are bedridden for long periods of time, or people who have had a trauma such as, let's say, a hip fracture or a femur fracture, and they are unable to move the leg for a long period of time. Then you have infectious causes like, for example, lobar pneumonia, which is basically pneumonia affecting one lobe of the lung, or bronchopneumonia, which is more diffusely spread across the parenchyma of the lung. That's pneumonia is mostly bacterial due to streptococcus or staphylococcus and other types of organisms. Another infection, common infection that is seen mainly in developing countries of the world, as well as places which are overcrowded, poor socioeconomic conditions, and also among immunocompromised people, is tuberculosis. Tuberculosis also can cause sudden deaths due to various reasons, such as maybe, let's say, a cavity which erodes into a blood vessel and causes sudden bleeding, and so on. Another condition, respiratory condition that can cause sudden death, is referred to as the chronic obstructive pulmonary disease, which essentially is in two spectra, that is chronic bronchitis at one end of the spectrum and emphysema, where there is an enlargement of the airways, or more likely the distal airways such as the alveoli, and then the lung is just seen as multiple balloon-like structures. So there are also several causes affecting the central nervous system that can cause sudden death, and most of these are hemorrhagic causes, such as what you see here. And this is a picture of the brain showing a hemorrhagic stroke. So essentially these are situations where people have long-standing hypertension, or sometimes even when they have certain abnormalities in the smaller blood vessels that are in this area, they can have a bleed, a sudden bleed into the brain matter. Similarly, you can have scenarios like aneurysms developing in the cerebral vessels, and these aneurysms can come from either they can come from birth, in which case they are referred to as berry aneurysms, or they may happen later on in life due to conditions such as atherosclerosis. So when these kinds of aneurysms rupture, they generally cause a bleed in the subarachnoid space within the brain. You may remember from your brain anatomy that the brain is covered by certain types of meninges, and the arachnoid mater is one such meninges, one such layer of meninges, which basically conveys most of the blood vessels. So when there is a sudden subarachnoid hemorrhage, that generally causes a rapid and fatal death. Next, let's talk a little bit about the traumatic causes of sudden death. There are several, and I'm not going to go into detail into each and every one of these causes, but some of the causes you need to know. For example, there are several reasons. There are several types of asphyxial deaths, which may involve either suffocation. Suffocation is where there is lack of breathable air in the environment. Think of a scenario where someone suddenly puts a plastic bag over your head. So suddenly the amount of air that is available to breathe is only the air that is within that plastic bag, because a plastic bag is impermeable to air. So similarly, situations like choking, that is where a person is consuming something, eating something, and then suddenly, instead of that particular type of food going into the esophagus, it just enters the airway. That's called choking. Then you have certain actions done by other people which can actually compress your neck, and by compressing the neck, sudden deaths can occur mainly because of the hyperstimulation of the nerves that are on the sides of the neck, which are called the vagus nerve. Now these vagus nerve are very important because they are actually one of the main controllers of the heartbeat and also the respiratory system. So if there is an overstimulation of the vagus nerve, that can lead to a sudden stoppage of your heartbeat. Similarly, another interesting condition is the trauma that can happen to the side of your neck. And what happens here is that there is a very important artery called the vertebral artery that runs upwards along the back of your neck, on either side. And this is also one of the supplies of the arterial flow into the brain. Sometimes when there is a sudden jerky trauma to the side of the neck, there can be trauma to this artery, and this can actually lead to a subarachnoid hemorrhage, just like what I showed earlier, and that also becomes a sudden death. Scenarios like electrocution, again, are very important causes of sudden deaths because they just happen so fast, and sometimes if it's not witnessed, no one may actually know that a person got electrocuted, and this is sometimes seen in certain types of factories or even at home. There is only one type of injury that can be seen in such situations, which is called a jewel burn. And if we do not see that particular jewel burn, or if we miss the jewel burn, which sometimes can be very, very small, we may think that this is a completely unexplained death because there is no other pathological feature in electrocution. Similarly, you need to know a little bit about the effect of toxic substances on sudden deaths. And I'm sure most of you can recognize the personalities shown in this slide. There are several celebrities who have died suddenly, and almost all the time these kind of situations involve the use of some illicit drugs, usually cocaine or methamphetamine or heroin, and of course combined with alcohol or some other types of psychoactive substances. So really, both in terms of overdosage as well as certain types of synergistic effects, especially when drugs are used in combination, can cause fatality even in therapeutic doses. It's very important to realize that. And in most of these deaths, when the postmortem toxicological analysis came back, they found that individually the drugs were within normal ranges or within non-fatal ranges, but the death was purely because of a combination of different types of drugs. So it's very important to understand this principle when investigating these deaths, because just by looking at the actual quantitative values, we may assume that the drugs were not the cause of the death. But we also have to look at certain other situations, like for example, did this particular person also have some kind of natural disease that could then enhance the effect of the drug? And in fact, some types of drugs, for example, alcohol, methamphetamine, cocaine, these types of drugs also change the dynamics of your body, and they can actually cause several pathological changes, structural changes within your body that can then lead to even natural causes of death, as what we discussed earlier. For example, if we look at methamphetamine, which probably is the most consumed type of narcotic substance in Malaysia, um, commonly known as ice or crystal meth. This drug can actually cause several abnormalities, mainly in the heart, such as, for example, atherosclerosis of the vessels, which I discussed earlier. We talk about smoking and atherosclerosis. You would have heard how smoking is a risk factor for atherosclerosis. So likewise, even methamphetamine also can cause atherosclerotic narrowing. And in fact, you know that methamphetamine, the main action is a dopaminergic activity. So there is a high level of catecholamines that are circulating when a person is under methamphetamine. And this high level of dopaminergic activity can actually cause several changes in the blood vessels and sometimes cause them to bleed, and more interestingly, sometimes cause what is called an arterial dissection. So this is an example of a coronary artery dissection, where basically the inner layer of the artery ruptures, tears, and instead of the blood going through the normal lumen, it also enters the layer underneath that tear. And so it's actually a blood tracking along the wall of the artery. And methamphetamine related deaths have been reported in relation to coronary artery dissection. Similarly, the dopaminergic activity over a long period of time tends to cause what is called a cardiomyopathy. In other words, it weakens the muscle, the cardiac muscle. Another change that can happen important change is pulmonary hypertension. Now, usually when we talk about hypertension, we refer to hypertension within the systemic circulation. In other words, the circulation that is supplied by the aorta, and the pulmonary arteries, are supplied by the right ventricle. So it's only just pulmonary arteries going to the lungs, that's all. So usually this artery does not get affected by hypertension, but due to several reasons, pulmonary hypertension also can happen in people, and methamphetamine use is one such reason to cause pulmonary hypertension. Again, a very important reason for sudden deaths in people, in methamphetamine users.